has its
control the
effect.
most basic physiological processes, such as breathing and heart rate. The spinal cord is the pathway for conveying information between the brain and the rest of the body. Between weeks 4 and 8, the embryo grows rapidly and the face becomes recognizably human.
And again, the very front part of that yellow brain is where marijuana is effective.
2 distinct hemispheres of the cerebral cortex emerge. At 8 weeks and the beginning of the fetal period, neurogenesis, the creation of new nerve cells, and synaptogenesis, the creation of more axons and dendrites that interconnect brain cells, rapidly increase the amount of brain tissue. The young neurons move from the innermost layers to other locations, such as the cerebral
cortex. At their destination, so once the neuron gets there, each neuron cell body will sprout multiple receivers, which are called dendrites, and a single sending arm, which is called an axon. So every neuron has lots of dendrites and a single axon, but you'll notice this has a lot of little fingers projecting out. So lots of contact surfaces. They don't all end up looking like this, as we'll see. When I'm diagramming it, this is going to be the neuron cell body, and these little pokey things are going to be the dendrites, and this would be the axon from this nerve cell body, and this would be the axon from a different cell body that's trying to talk to this one. Just so you know, when you see my little feeble diagrams, that's what I'm trying to say. So carrying on with the brain architecture, here you've got the dendrites beginning, and this is the axon.
Enormous travel determines the axon's length. At a junction called the synapse, communication occurs when a neural impulse at the end of the axon stimulates the release of a chemical neurotransmitter that crosses the synapse to the second neuron's receiving dendrite. Communications continue, and the rate of synaptic formation, or synaptogenesis, increases rapidly into the first year of life. Researchers often describe this growth as exuberant synaptogenesis. At week 28, something new happens. The cortex, a sheet of cells, expands in surface area. It wrinkles and folds inside the skull, forming hills and valleys called gyri and sulci.
And those are needed to accommodate the tremendous volume of neurons that are formed. Each neuron is different in terms of where, depending on where it's located and what its function is going to be. So in the hippocampus, which is our memory central, this is what the neurons look like. So you've got this would be your axon with lots of little fingers reaching out. These are all the dendrites, all carefully arranged, each one different. Here, these are the dendrites, these are the axons. Then the cerebellum looks totally different. So incredible precision, incredible finesse that goes into what our brains look like and how they operate. So over the months before birth, tens of billions of neurons have to be correctly and precisely created, differentiated, delivered to the correct location, and correctly connected. And again, it has to be very precise for this brain to work properly. So what could go wrong? What could marijuana have to do with any of that? Well, it does not kill neurons. Alcohol does, and that's important. But it disrupts the organization of neurons and their connections. The smoke from marijuana, like the smoke from tobacco, starves neurons of oxygen. And marijuana messes with the genes. So we'll come back to that. So to focus in now on marijuana versus prenatal brain development, any agent that harms a developmental fetus before birth is called a teratogen. Agents that harm the developing brain, like marijuana, alcohol, and tobacco, and also toxic stress, are behavioral teratogens. So marijuana is a behavioral teratogen. It interferes with the function specifically of the endocannabinoid system. So cannabinoid, cannabis, yes, that is the same issue. Before birth, the ECS, or the endocannabinoid system, directs development of the limbic or emotional brain and the prefrontal executive director of the brain. So prenatally, the ECS is not present throughout the brain, but it's in these two really critical areas. The limbic system handles mood with the amygdala and memory with the hippocampus. The prefrontal cortex handles filtering, focus, emotional regulation, and organization. Prenatally, the endocannabinoid system directs the precise specialization, localization, and connections for the neurons of the developing limbic and prefrontal cortex. Marijuana messes with development of the ECS, so the ECS doesn't correctly call the plays for the neurons it's supposed to guide. So neuron formation and specialization are messed up. The migration of movement is messed up. The extension of the axons, their directional where they go to, is messed up. The multiplication of dendrites and the axonal neurites, and the connections. So it's very, very disruptive. It results in a prefrontal that is not working well. If the prefrontal brain is limited, the brain uses what's called the FAST pathway, bypassing the cortex, which is the thinking part of the brain, and you have impulsive, emotional, reactive responses. So somebody bumps into you and you hit. Versus with an effective prenatal cortex, the brain uses the slow pathway, allowing the thinking brain to focus, calm, plan, organize, and stop. Oh, you bumped into me accidentally, no problem. An inadequate prefrontal activity results in bypassing of the thinking cortex. What happens when marijuana disrupts the fetal endocannabinoid system? Well, in the limbic, emotional, and prefrontal executive brain, there's disrupting disturbance of the nerve specialties, where the nerves go, where and how far the axons grow, and where the axons connect. So here comes a technical term. The organization of the neurons in the prefrontal and limbic system is messed up. You can just remember that. The organization is all messed up. But marijuana also alters the wiring and genetics of the dopamine brain reward system, which happens to be in this area. And this makes addiction more likely later on. So here you have a baby before birth who's getting programmed to become an addict. That's a scary thought. Prenatal marijuana exposure can result in severe lifelong problems with mood or emotional problems, with memory and learning problems, with management, that's the whole prefrontal piece, including emotional ability, because you can't control the emotions, and reward, the addiction risk. That combination, if you look at these first three especially, is going to give you a very miserable childhood. You're going to get a lot of people yelling at you. You're going to have a difficult adolescence. You're not going to be very successful as an adult. And all these things are going to contribute to you feeling pretty lousy about yourself because people keep giving you these negative messages. Now, smoke is another big problem. We weren't talking about smoke. Pregnant women and infants should not even be around marijuana or smoke of tobacco. Here you've got the hemoglobin molecule, which is in red blood cells, and it should be carrying oxygen bound to this iron. But when you've got carbon monoxide, the carbon monoxide displaces the oxygen, tosses it off to the side and says, no, I'm better. It has a better bond. So you end up with oxygen-starved cells because these red cells are now carrying around carbon monoxide instead of oxygen. And marijuana smoke has 5 times as much carbon monoxide as tobacco smoke. So that would cause slower growth and lower birth weight, smaller head size, a risk of premature delivery, and risk of death. Harm from smoke of tobacco and or marijuana. In addition to the smoke, the carbon monoxide issue, you also have toxins in secondhand smoke and vapor. And in fact, you even have those toxins residual in carpets, furniture, drapes, clothing, cars, etc. So it still continues to be a problem, even if the person is no longer there, but if you're in a place that all it smells of it. And there are 2 kinds of problems you get. One is that some of the compounds, the toxins, are carcinogenic, so that they cause cancer, where it distorts the cells. It also is toxic directly on tissue, so that you can get damage to the liver, the brain, and also the bone marrow. Findings from large-scale studies of children whose mothers smoked marijuana at least once a week during pregnancy. There were findings of decreased birth weight, decreases in the dopamine D2 receptor levels in the brain, so that's that reward center disturbance. In early development, problems of verbal reasoning and short-term memory, more aggression in females. Interesting how the male and female brain are different in this. Anxiety, depression, impulsivity, and attention hyperactivity. This is all the prefrontal issue. In adolescence, depressive symptoms. Now, part of that may be, in fact, from the lived experience of not being able to do what you want to do, not be able to put the brakes on when you need to, not be able to steer where you're trying to steer because your prefrontal isn't helping you out there. Problems with abstract reasoning, more delinquency, and antisocial behavior. And in adulthood, again, memory problems and drug-seeking behaviors. These studies worked to control, they're large studies, and they work to control for things like smoke, tobacco use, alcohol use, environment, SES. But if you look at rodent studies, you escape all those problems. And the rodent studies show decreased birth weight, more hyperactivity and anxiety in early development, poorer synapse formation. This is the prefrontal cortex isn't doing its work, and problems with that reward center. Anxiety in adolescence, problems with memory and socialization, which of course any of the impulsivity kind of stuff, prefrontal is going to interfere with socialization. And the adult rodent, problems with socialization. Notice the opioid seeking, and also if you scan down further, opioid receptor abundance in prefrontal cortex. Not a good thing. So these are rodent studies. This is just cannabis exposure. So marijuana exposure before birth is associated with disruption of brain development before birth. Smaller size at birth, higher risk of stillbirth, higher chances of being born too early, especially when using both marijuana and cigarettes during pregnancy. Harm from secondhand smoke, and also smoke from tobacco would be the same. Behavioral and attention problems and addiction. Now, tobacco smoke clearly is problematic as well as marijuana smoke, and it may be that these issues, the smaller size at birth, higher risk of stillbirth, higher chance of being born too early, these may in fact be the carbon monoxide problem from smoke, but the behavioral and attention problems clearly are related to the direct effect disrupting brain development before birth. This is a study, the ABCD study, Adolescent Brain and Cognitive Development Study. And they started with 11,875 children between 9 and 11 years old, did parent and caregiver interviews, and also studied the brains of these kiddos, 52% males. Of those, 5.7% reported exposure during pregnancy. If the mom said that she stopped when she learned she was pregnant, they recorded that separately from those who didn't. So these 242 are the cases where the mom said she continued to use marijuana during the pregnancy. And the significant findings compared to non-exposed children were the lower brain weight, total intracranial volume, and white matter volume on the MRIs, and more psychotic-like experiences, PLEs, and more externalizing thought and socializing problems. When they controlled for the confounding variables like smoking, tobacco, and alcohol, there were still more psychotic-like experiences and more externalizing thought and social problems. Externalizing problems, thought problems, social problems. Okay, so this is all, again, prefrontal and limbic. So, but on this study, there was no distinction made between ingesting edibles and smoking. So whether this lower brain weight issue that settled out, we don't know whether these moms were mainly edibles, mainly smoke, or combination. But the people that said they stopped once they learned they were pregnant, those subjects, the children, there was no significant difference from non-exposed. So it appears that this occurs not in the very, very first weeks. And that makes sense, as we will see in a little bit. Now, they followed up with these kids now 2 years later, using the child behavior checklist. For those cases where the marijuana was used continued to be used subsequent to recognizing was pregnancy, almost all the factors were significant at the 0.05 level, and most of them at the less than 0.001 level. Oh, and I forgot, this one should have been circled too. Oppositional defiant problems should have gotten a circle, and I think it might occur later. I might have not tagged it right. When you compare that with those who stopped when they knew they were pregnant, very big difference. Oh, that's my circle on the oppositional defiant problems. So prenatal cannabis exposure, which is what PCE is, was associated with persisting vulnerability to psychopathology throughout early adolescence. And these associations did not change with age. So going from the first group testing to 2 years later, the problems were still there. So the effects of prenatal marijuana, again, not killing neurons, does disrupt the organization. The smoke does starve the neurons, and you mess with the genes. Now, another problem with marijuana is contaminants. Infections can go along with marijuana, and that can kill neurons, can also kill babies, actually. And you can also have, the infections also can interfere with the genetic function if they're viruses. Poisoning, lead and other heavy metals are often contaminants of marijuana. And lead and the heavy metals poison the energy producers. Pesticides also mess with the genes. So these are problems with contaminants. I'm also including a look at the 2 other common behavioral teratogens. So alcohol does kill neurons, and it also disrupts the organization and the connections, which is why you see both generalized brain deficiency, so retardation, and you see disrupted learning and memory. It's tobacco that would starve the neurons, both by narrowing the blood vessels and from the carbon monoxide. And it also genetically disrupts, it disrupts genes and actually is carcinogenic. So what if a woman is using marijuana or any other teratogens and gets pregnant? How soon does she need to stop? First, let me give you an alert to epigenetics risk. Epigenetics is when you make a change in parts of the genome the genetic material that direct DNA and tell it whether to turn on or off. Recent research is suggesting that exposure to some teratogens like marijuana by either parent, either the prospective mommy or the prospective daddy, even years before pregnancy, may alter the genetic regulators in the ova and sperm stem cells that could put the eventual offspring at risk for conditions such as autism. That possibility is a good reason for males as well as females to stay away from behavioral teratogens before they've had all the kids they want to have, including marijuana, alcohol, and tobacco. But that research is still in early stages. So I'm not ready to say, okay, this is so. I'm just saying, watch for it. If the person's using anyway, if a gal is using anyway, she should stop immediately if the pregnancy test turns positive, which could happen before the next period is due. But if she hasn't been testing every month, well, let's think about it. When an embryonic period, which is 15 days to 8 weeks post-conception, could the brain development first be directly harmed by a teratogen? Well, we know that this little beginning brain groove is starting at 16 to 19 days. It turns out that the endocannabinoid system doesn't actually begin to appear effective until 5 weeks. Can you see, you just barely beginning this little brain up here. So 2.5 weeks post-conception, brain construction starts. So brain development is beginning when the period is less than a week late. The period is less, so 2 days, so just barely missing. The ECS cannabinoid system begins 5 weeks post-conception, but marijuana can remain in the body for several weeks. So we look at the last period. This period is 2 weeks late because we had conception start here. This is when the period's due, but it's late. And bingo, right here, you've got the brain beginning. So you need to stop tobacco, alcohol, other teratogens right then. But how about marijuana? Maybe not an issue because it isn't until 5 weeks that you get that system really working. Oh yeah, but marijuana hangs around in the body. So yes, stop marijuana at the same time. So bottom line, if the period is late, stop all teratogens. If it's just a day or two late, stop. Protect her baby. When does the woman need to stop using teratogen? It's best not to use in any month in which she might be sexually active. Otherwise, if she is using and she's sexually active, she should stop anytime the menstrual period is 2 days late and stop if a pregnancy test is positive. And not use again, and that's either one of those. That doesn't take both, either one, whichever happens first. And don't use again until the arrival of either the period, a full robust period that's clearly the period, or the new baby. And she has stopped breastfeeding. That brings us to the still developing brain after birth. can marijuana exposure cause present or future harm to infants, toddlers, teens, and our young adults? Well, everybody here knows that the answer to that is yes, but we're going to drill down. So after birth, the brain is still vulnerable to damage by marijuana. The infant could be exposed via breast milk and secondhand smoke. The brain more than doubles in size in the first year due to massive increase in the number of dendrites, those are the receiving arms, and their connection with axons. All these connections, remember, are the synapses. After birth, synapses are the primary locus of marijuana's neural harm, and that's throughout the brain. In the first 2 years after birth, 1 million synapses are formed every second, forming over 250 trillion synapses by age 3. That's 3 times the number in the adult brain. Pruning is going to remove unused synapses as the brain becomes more efficient and specialized. So what you don't use goes away. So again, the synapse is where the axon from one neuron meets and can send messages to a dendrite of the next neuron. Neurotransmitters are the chemicals that carry the message across the synapse to the next neuron. When a message is repeatedly sent across a synapse, the receiver on the dendrite changes. You get long-term potentiation, and the dendrite changes that makes the synapse permanent. When axons don't send messages across synapses, the dendrite receivers shrink, the axons wither. Unused connections are pruned. Psychoactive agents like marijuana, alcohol, and opiates alter synaptic neurotransmission. Chemistry determines how long after use there's still risk to the baby in terms of breastfeeding. Water-soluble toxins like alcohol clear the body within 24 hours. Fat-soluble toxins like marijuana can be stored in fatty tissue for days to weeks, depending on how much has been used at once and over time. As breast tissue is fatty, if a woman is using marijuana, it can be stored there and can enter breast milk days to weeks after it was last used. Now let's take a time out for terms. Marijuana, when I say marijuana, I'm talking about cannabis. Phytocannabinoids are cannabinoids that are coming from plants. Endocannabinoids are cannabinoids the body makes normally. THC is a cannabinoid, and it is specifically tetrahydrocannabinol. I always said over that. It's the main ingredient in marijuana that affects the brain. Cannabidiol, or CBD, is thought to have a different brain action than THC. Epidiolex is FDA-approved CBD, so it's very finely produced, controlled. It's approved for a particular type of seizure, but the use of CBD in general is not known to be safe for the developing brain, and non-FDA approved CBD is often contaminated with THC, as well as heavy metals, bacteria, and funguses, which are toxic and infectious dangers to fetuses and infants. So one neuron's axon messages a dendrite of the next neuron by releasing neurotransmitters. In many areas of the CNS, the dendrites can release endocannabinoids to act upstream on axon receptors that will modulate neurotransmitter release. Phytocannabinoids will bind to these receptors on axons and reduce neurotransmission. So phytocannabinoids from plant cannabis can significantly reduce neurotransmission. Robust synapse formation requires lots of transmitter activity. So reducing neurotransmission can weaken or destroy synapses, as well as interfering with current function. Building on infants' neural networks relies on vigorous synaptic activity. As marijuana from breast milk reduces synaptic activity in the infant's brain, synapses are lost or don't form, axons atrophy, and neural networks are compromised. Now, a moment to talk about marijuana edibles. Why is it so important to make sure that children don't see or have access to edible forms of marijuana? Notice the little asterisk here. They're yummy. The dose of THC in marijuana is very big in edibles. And it takes hours to see the effects. By the time you see the effects, it's too late to, vomit, to empty the stomach or anything like that. And it can cause breathing problems and even death. So it's important to keep edible marijuana away from children. Inhaled marijuana is promptly symptomatic. within a minute or two, you begin to feel the effect, and it clears the system in an hour or two. But symptoms from eating edible marijuana may not be evident for 2 to 4 hours. And so at 2 hours, the child may be feeling the effect, but you may not see it. So it may be 3 hours before or 4 hours before you actually realize, oh, this kid is falling over, is falling asleep, is not acting right. The recommended adult starting dose is 1.25 to 5 milligrams. That's for a person who's not a regular user. How much THC might a hungry toddler get? Well, these gummies, each candy has 33 milligrams. This candy bar, a dose of 5 milligrams is one little tiny square. The whole bar has 100 milligrams. Caramel corn, toddlers aren't as likely to do well with that, but 60 milligrams. And then there's delta THC, which is made from hemp, and it's packaged for kids. Synthesized from CBD and hemp to form a concentrate of THC, it's added to gummies, brownies, vapes, and tinctures with no regulation, no guidelines about quantity or quality. It's actively marketed to children with packaging like snack food, sold in convenience stores and gas stations. It's marketed as being safer, but quantity and quality of THC are unknown. It's less regulated than marijuana even. There's no evidence that it's any less toxic or addictive than marijuana, and additives that are used to cause this transformation from CBD to THC may themselves be toxic. In terms of what intoxication looks like, poor coordination, imbalance, trouble sitting or standing may be the first thing noticed. Drowsiness, can't awaken the child. Forgetting to breathe. Obviously, that's why you need to go to the emergency room. Many young children require hospital admission due to the severity of their symptoms. This study was done through the National Poison Control Data System, looking at 1,000 calls per year. And I'm sorry, the graph represents the ingestions per 1,000 calls per year among 0 to 5-year-olds. I didn't say that very well. So a huge increase when you go from 2017 to 2021. Well, you might say, yeah, okay, but it was going up at 2019, but then we had the epidemic of COVID, right? So maybe that's it. Well, but also obviously legalization was occurring in terms of marijuana. So in fact, at the beginning of 2017, only 6 states had legalized recreational marijuana. And by the last study, so through 2021, there were 18, so triple the number of legalized states. This graph shows for children 0 to 5, 2017, looking at more than 800,000 poison control center calls in each of the time periods. There was a 1,375% increase for exposure to edible cannabis between 2017, which is the blue bar graph, and 2021, which is the orange bar graph. Again, maybe that was just because of COVID, but this looks at the decrease in overall poison control calls. So actually, from 2017 to 2021, there was a 12% decrease in all poison control calls for 0 to 5-year-olds. So it wasn't about COVID. It was about legalization. Over that period of time, there was also an increase in the percent of moderate and severe cases, with more being admitted to critical and non-critical care beds and fewer being released after treatment in emergency departments. The highest, not surprisingly, was in 2 to 3-year-olds, least in 1 to 2-year-olds, in kids less than a year, so birth to 1, because obviously they're not able to get into this stuff. But once they're toddlers, there they go. Big concern. Now, in older children, teens, and adults, including parents, acute marijuana intoxication can cause bad feelings, altered perception, anxiety, panic, and paranoia. Trouble getting around. That's what we recognize more readily in the kids. It's hard to see these effects when we're looking at a toddler. Dizziness, weakness, slurred speech, poor coordination. And then shutdown, excessive sleepiness, apnea, which is not breathing for 10 seconds or longer, and heart problems. Marijuana use in teenagers is high. In this study, which is a huge Monitoring the Future study, the 2023 data, approximately 9% of 8th graders and 35% of 12th graders are reporting using some marijuana. So edibles, there's particularly a problem with adolescents, and this reference refers to how parents can prevent TPH poisoning by their teenagers using edibles. So the first is to try to find out what and how much was eaten, look at the wrapper to see how much THC it contains, and call the pre-poison control hotline, which is at 1-800-222-1222, as soon as possible for fast help. Marijuana is bad for the still developing brain of adolescents and young adults. By adolescence, the endocannabinoid system is active everywhere in the brain. It isn't just in the prefrontal and the limbic. But the prefrontal is still developing. Actually, prefrontal synaptogenesis and pruning increase during adolescence and young adulthood. The prefrontal brain is remodeling itself in order to become an adult. By disturbing the ECS, marijuana interferes with synaptogenesis. It compromises synaptic plasticity that's required for prefrontal remodeling. So it messes this up. And marijuana causes changes in regulated genes for neurotransmitters. And this is what leads to the risk not only of addiction, but also psychiatric disorders. So again, chronic marijuana use in adolescence tends to lead to a persisting adolescent. They just never become an adult. And use in adolescence and early adulthood predisposes to psychiatric disorders as well as addiction. And again, if we think about decreasing neuron firing, we're going to decrease neuron wiring. Unused dendritic spines are pruned away, synapses are lost or don't form, axons atrophy. So you're left with these neurons that aren't going anywhere. So decreasing wiring means networks are less sophisticated. Control is less precise. There are fewer outlets of knowledge to power new learning and skills. Maturation paused or delayed with chronic use. The impairment severity is determined by the age of use, how many doses are used and what the strength is, the frequency, the duration, use with accelerants, both alcohol and tobacco, either alone or separately, either separately or together, increase the negative action of marijuana, and also the genetic vulnerability. So 1 or 2 smokes in adolescence is not going to cause this cascade of events. Chronic use is. There are major public health worries about marijuana. First of all, the concentration is now much, much higher. The THC concentration is much, much higher than it used to be. In plants, it's gone up between 20 and 28%. I just read an article that said 30%, compared to 4% in 1995. They're growing it to be stronger. In edibles, it's especially high. You can get up to 70%. Higher doses of THC are more likely to produce anxiety, agitation, paranoia, and psychosis in adults and teens. And actually, a psychopharmacologist just told me that as they are concentrating the THC, they may actually be decreasing the amount of CBD available, and it may be the CBD which gives more of the relaxation effect that people seek. The increasing concentration of THC in marijuana makes it easier for adults, anybody, to get too much. And edibles are the worst. So it's not uncommon that you'll hear an adult say, oh yeah, I tried one and I didn't feel anything, so I took another, and I didn't feel anything, so I took another. Yeah. So what effects from having too much marijuana might be a problem for parenting? Well, the same things. It's not a good idea to be paranoid or to have poor, distorted perception. Poor coordination isn't too good when you're handling a baby. Dizziness, and certainly falling asleep when you're trying to care for a little one is not good. So, second big problem, public health problem, inadequate regulation. The Delta-8 THC marketing to kids, huge problems, unreliable concentrations, and contaminants. This is a very good article on cannabis contaminants, issues regarding solvents, microbes, and metals and metals in legal weed. This is an article I saw. It was in November. Paper that in Arizona indicating there was recall of product of marijuana contaminated with aspergillus, which is an organism that can be very dangerous, particularly if people are infants or have a problematic immune system. And in that same article, it mentioned that the ADH laboratory auditors, in this case, discovered discrepancies during a routine inspection. The discrepancies would have potentially led to false negative results for contaminants being reported. In other words, the reports were being made, but they weren't accurate. Okay, the third problem is persisting use of marijuana during pregnancy, as well as persisting in youth. Marijuana use is very high in less advantaged urban mothers. A third to two-thirds of women who use marijuana continue its use during pregnancy. And legalization is really increasing this problem and will continue to do so until problems of prenatal exposure become more widely publicized. And Marilee was just telling me that she's hearing about obstetricians and general family doctors who are suggesting that moms go ahead and use marijuana during pregnancy for morning sickness. That's something we have to change. Stat. Many women perceive that marijuana is safe for pregnancy. It doesn't help if the doctors are telling them that, while knowing that tobacco and alcohol are not. Note that we cannot judge the amount of use of marijuana by what people say. If you look at cord blood, huge difference. This is 22% versus self-report, what people tell the healthcare provider they're using, which is only 2.6 versus 6% in the report about survey. So the survey is anonymous, so that might help, but still compared to what is found in cord blood, it's quite different. Now, of course, part of this is because there's a time lapse in terms of what shows up in cord blood. So people may have forgotten they used it. Yeah, maybe. Beliefs and attitudes regarding prenatal marijuana. This was a study looking at perspectives of pregnant women who report use. They used semi-structured interview with 25 women using marijuana during pregnancy. The main themes that emerged from the interviews were that women reported higher amounts of marijuana use prior to pregnancy and attempted to reduce their use once they realized they were pregnant. They used marijuana to help with nausea and appetite changes during pregnancy or to improve mood. They described marijuana as natural and safe compared to other substances such as alcohol, tobacco, and other recreational drugs and prescribed medications. They had conflicting opinions regarding whether marijuana was addictive, and they were uncertain but had some concerns regarding potential risks of prenatal marijuana use. So again, they know about the risks of alcohol and tobacco during pregnancy, but not marijuana, which is why we are gathered together today and why our work is so important. They assume the safety of marijuana since they don't know of its risks and they call it natural. But natural doesn't mean good and safe for you. Rattlesnakes are not good for you. Poison ivy is not good for you. So again, thinking that it's safe and natural is a problem. No study proves that marijuana helps with morning sickness. And for a baby, there's no known safe amount of marijuana during pregnancy or breastfeeding. So it's review time. You can write this down. If you got the paper printed out, you can write on that. Otherwise, just make notes. And this is what the paper looks like. But you can fill it in later. So let's review what potential parents need to know about marijuana. What does marijuana do to the organization of nerves in the developing brain? You all know that one. It messes it up. A child or teen who is exposed to marijuana as a fetus is likely to have problems with mood, memory, management, and reward. You might, by the way, put down prefrontal brain and limbic brain or lobes for this and for the prior question. Why is it important that pregnant women and infants not even be around smoke for marijuana or tobacco, carbon monoxide, and toxins? And of course, the carbon monoxide would affect the whole brain. Why is it important to make sure that children don't see or have access to edible marijuana? It's yummy. There's lots of THC. The effect is delayed, and there's a danger of stopping breathing. For baby's sake, when is it critical for a sexually active woman to stop using any marijuana, cigarettes, alcohol, or other teratogens? When the period is 2 days late or her pregnancy test is positive, whichever comes first. Give examples of problems for parenting that marijuana might cause, bad feelings, any of these, altered perception, anxiety, panic, paranoia. Trouble getting around, dizziness, weakness, slurred speech, poor coordination, shutting down, excessive sleepiness and apnea, or heart problems. And why is marijuana a problem for the brain development of adolescents and young adults? It impairs the wiring needed for the still maturing brain for new learning and brain plasticity. And it can alter regulator genes related to addiction and mental illness. 3 major public health concerns related to marijuana are increasing concentrations of marijuana, inadequate marijuana regulation regarding delta 8 THC in general, which is not the regular, and then concentration and quality of THC in general, which is delta 9. And the 3rd major public health concern we talked about is the high use of marijuana in pregnancy with ignorance of the possible consequences. And that, of course, is my number 1 concern. Let me quickly go back. So that you have a chance to fill those in. So remember, a good brain requires precision building, and from conception through the first year, a baby's brain is growing rapidly. Throughout pregnancy, on average, 250,000 new neurons are born each minute, peaking at 500,000 during the 2nd trimester. In the first year of life, brain size is more than doubled by the developing networks of axons and dendrites. Exposure to brain toxins, stress, or inadequate nutrition during pregnancy and infancy compromises foundational brain architecture. So avoid lifelong problems, prevent teratogen exposure during pregnancy and infancy, including exposure from toxins in breast milk or secondhand smoke. And protect the adolescent brain as well. So we need help spreading the information. I want you to please share what you've learned with your family and friends, community, clients, other staff. In terms of clients and community, the information that I shared, which is shared on your on the link that was sent, the email that was sent yesterday, and maybe Marilee will send that out again. These are ones that we will go over in a moment here, and let's think about how you would share them, and then we'll go over what they are in particular. You could informally talk to individual families, give them handouts, give them pocket cards, post on your program's website or blog, copies of the handouts, links to videos, links to informative websites. Use posters. One of the handouts I have gives you links to some posters. Schedule a mini class. Arrange for this presentation to be given in person or via Zoom. And you can make these contacts, which were on the first slide. And I never charge for my presentations. If you want to charge, that's fine, but I never charge. Now, in terms of the handouts that are attached, the first page of this flyer, and I misspelled it. I said flyer, which is like somebody who's flying. This is a flyer, the thing, sorry. The first side of it has basically an overview of what we've talked about. And the second side has references, overviews, research, and some clinical things that are particularly good for the patients to look at quickly. And by the way, this Department of Safety, the Marijuana Department of Safety site has excellent resources, really, really good. You see, these are all QR codes to some of the articles. Also, I did not put on here Mother to Baby, and that was an oversight on my part, but mothertobaby.org mothertobaby.org has very good material. Just go to that website and search for marijuana, and you'll come to a very good resource. I have also included templates for marijuana pocket cards. State of Oregon has wonderful little pocket cards. Arizona, to my knowledge, has not yet done that. So we made our own. And basically you can use these by copying them onto two-sided business card stock, comparable to Avery 5877. And you'll have your own to give out wherever you go and whoever you talk to. Another flyer, the resources and references page. This has a whole bunch of resources for parents and professionals. The first part is those includes that AZDH's website, which is so good. Also, healthychildren.org from the Academy of Pediatrics has excellent resources. This section, marijuana use during pregnancy breastfeeding, is very, very good. On the lower half of that front page, marijuana resources for professionals. So this includes these overviews from the Surgeon General, the Academy of Pediatrics, and obstetric organization. And then on the second side, the top part has sources of posters and message cards, including the Oregon one, and then the resources that I've used in this presentation. I've included most of them. So each brain matters. The more we know, the better care we can take, and that can make all the difference. I am grateful to all of you for the work that each of you is doing for your community, for community well-being, and I thank you for attending this morning. I'd be very grateful if you'd complete the brief survey for Each Brain Matters, the Center for Neuroscience Foundation, which was included in the email that was sent out to all of you. And with that, this is the contact information, but now I'll stop sharing and turn it over to Marilee and say hi to all of you.
Thank you so
Nice to
much,
see
Dr.
faces.
Johnson.
My pleasure.
Such important information. You know, it's been really fascinating, working with MATFORCE and looking at ways to prevent and reduce substance use, how people that use marijuana just actually glorify that drug and all of the misnomers that it's safe. And it just seems like people aren't really willing, to hear some of these truths that are coming out through science. And so Nikki has a question for you to start. How can we get this information to policymakers?
Yeah, that's something we need to do as fast as we can. And I know that you folks at MATFORCE are working on it. I think maybe I should open that up to everybody. I'd like to hear input on that. Anybody chime in, please. You should unmute yourself.
Maybe you can call your representative, your state representative.
Suggestion. And I was really excited at the end, a lot of those resources that, you've talked about and have made available through, the email. I think, again, just figuring out ways, good point to hand it out to them is another one. Yeah.
I think, the effort needs to be concerted. We need to keep talking about it. We need to keep reaching out. And I think basically, I'm reminded basically to send information to everybody, to every legislator. They always like to hear best from their own constituents. So each of you, since you represent a scattering throughout Arizona and maybe elsewhere in the nation, but get to your individual representatives, and I will do my part to try to see if I can get something out to everybody all at once. We also have to look at people that are candidates and make sure that the candidates are getting good information. Other questions?
One other question. There was a study that recently came out showing a link to from prenatal marijuana use, and we actually both the mother and the father with a link to autism. Have you read that study, and do you have any information on that to share?
Yeah, so that I mentioned that briefly. That is the prenatal exposure causing an epigenetic change that may predispose to those DNA chemicals, that the genes that would regulate, would allow autism to occur, to be changed. So that's an early stage research, but that is the question being raised specifically with regard to autism in terms of what I've seen. Yeah, so exactly right. So that again could be male or female. The other thing in terms of male use is that it decreases fertility, so that if a man is trying to become a dad, then he should not be using it. On the other hand, it is not birth control. So I don't want anybody to think that, oh, well, I'm not going to get anybody pregnant because I'm using. No, that's not okay.
Another question in the chat. Why are some doctors saying it is okay to take small doses for nausea? Is this due to a slow move out of the information, or are the studies that are there studies that priorly supported this notion? I suppose what would we do if a parent says, but my doctor says it is okay?
Ignorance is the word that comes to mind. Yes, I like the idea of the slow move of information out the channel. And I think, you know, when you look at, it took a long time for everybody to recognize the danger of prenatal alcohol exposure. But pretty much the word is out now. And basically what we have to do is a fast ramp up. So again, this conversation reminds me of how important it is to get this word out aggressively to all the obstetric conferences. I mean, it was the obstetricians and pediatricians, both organizations came out with these master statements in between 2017, 2019. I don't know about GPs, family practitioners, and I think we may need to look more aggressively at that population. Pediatricians were very opposed to the legalization of marijuana in Arizona. And we're working hard to, as is MATFORCE, to get more information out about it. But yeah, we have to really work aggressively, and I will take that home. And I'd like everybody to take that home to your doctors, to everybody you contact with, that the medical professional needs to be accurate about this. And again, remember the industry, this is tobacco industry that we're working with. Remember what they did for decades and decades. My father was told that he should smoke tobacco because he had bad asthma and the tobacco would make his lungs stronger. This is the industry we're dealing with. He died young because of that. So yeah.
Thank you. Lauren
see-
has her hand raised.
Yeah.
Excuse me.
Lauren.
Hi, I was wondering, is this all pretty much based, all these statistics and information pretty much based off of smoking, like smoking flower marijuana and edibles, or where is the like studies behind vaping? And is it the same kind of issues with vaping and the smoke from a vaporizer as to smoking it the other way?
Okay, good. The vaping apparently is less of a problem in terms of carbon monoxide.
But that's about it.
In terms of marijuana use, the marijuana exposure is the same. If you're getting the effect from the marijuana, that means the chemical, the THC is there and it's doing its thing. So THC is the psychoactive chemical. So
Mhm.
anything we're seeing in terms of brain issues is coming from the THC.
Gotcha. Okay. Thank you.
Other questions? That was a very good question. Thanks. Any questions are good.
Here's a new question in the chat from Steve. Is there anything positive about the use of marijuana?
Good question. Yes, there is. First of all, its use for nausea and vomiting is clearly valuable for people who are suffering that from cancer. So if you're over 25 and you are in the throes of bad nausea and vomiting from cancer chemotherapy, it can certainly be very helpful. And once the brain is fully mature, so after 25, you still have issues in terms of toxicity. All those things that happen with toxicity can still happen. But all the other issues in terms of brain maturation are not an issue once you are eligible for lower rates on your insurance policy, bottom line, okay? So this 25-year thing is not a magical number. It's based on science. Certainly some people, adults can find it helps, a small dose can help with sleep. It can help with anxiety. But notice, in today's concentrations, you're much less likely to have relief from anxiety and more likely to become more anxious from it because the THC is so high and the CBD low. And
I just,
yeah, I was just going to say,
I apologize.
in terms of using, always start low, go slow. So you said you saw that the starting recommended dose for an adult is 1.25 milligrams as the dose, and you stop and you wait. And the next day, if you think, well, that didn't do anything, you might try it. So if you're trying to use it, if you're a senior citizen, you're trying to get to sleep and you can't sleep because our cycles get disrupted, start at 1.25. Don't use it with any other, don't use it with alcohol or any drugs that might alter your sleep or your alertness. And just be careful. But it can be addictive, even in adults. I worry about seniors in particular because I'm a very senior and we have cognitive problems anyway, and it can look like we're getting senile when in fact it's that we're using marijuana. So, but yeah, it can be useful.
Thank you. One last comment, the link, oh, she's asking for the link for the survey. Do you want to put that in the
If you'll just send that out to
chat?
me, it's, yeah, so
Yeah,
the email that I
we-
sent you yesterday, that's the same thing. You can put it in the
Okay.
chat too if you want, sure.
Yeah, it was sent out yesterday, and I will, yeah, make sure that if anybody hasn't got that, we can just send them out again to everybody too, if
Okay.
that's.
And we
that's
really
easier.
appreciate it. I use your feedback as I design the next talk. And I hope to talk to lots more of the people in your communities, if you will let me, if this has been of value to you, because obviously anything we can do to get the word out. And I just sit at my desk and do this, and it will be modified for any group. It's never the same for any two groups because the needs of the group are different. You are a more sophisticated audience than many of my presentations, which are to the, by and large, people who are first line workers, whereas you have a combination of first line workers and people that are probably have been doing this work for years. So yeah, so each one, you'll let me know who the audience is and I'll make a modification. And don't feel you have to stay, by the way. We're past time, so feel free to sign up. Thank you so much for coming.
And there's a question about a certificate. We can just give a simple certificate from MATFORCE if somebody requests that. If you would just let us know that that's something you want, Sophia, we can get you that. If you please give us your make sure we have your email address. And then I just one other comment, Dr. Johnson, through SACLA, the Substance Abuse Coalition Leaders of Arizona, and there's several people involved in that are on this call too. We have a toolkit, and I would love to we'd love to steal some of your stuff, pocket cards and different things that you've developed that we can help distribute. So
Please
thank
do
you
it.
for that.
Please
Yeah,
do.
because that's this great tools.
Yeah, everything.
So, and
just if you're using any of anything with references, be sure to check back to make sure that all the links work, because obviously they keep changing and one day they work and another they don't. Also check back and see if there's an update, because I may have, for instance, added the mother to baby that isn't on there now. So, but for the cards, anything else, use them, but just check with me if it's out there somewhere. Check from time to time to make sure it's the most recent version.
just want to make sure I didn't miss any. I see a couple other things. I'll make sure I didn't miss anything. Okay. Okay. I think I got, if did anyone ask a question we did not ask?
Did not answer.
I did not answer, right?
Or that you
Asked
did
and
not answer.
answered.
Right, yeah.
Great. So, okay. Thank you so much for your work. So important. And I know that all of us want to be, partners with you in getting this information out. So thanks everyone for
Also,
attending.
let me take one, sorry, one thing I forgot to mention.
Yes.
Our Each Brain Matters Coalition is now working together with AZCAN, AZCANN, which is at the University of Arizona. And that is a big program to get marijuana education out. And they reviewed my work to make sure that what I was saying was accurate. But they will be another resource for us. So they are just beginning. So I wouldn't say that they're the place to go look right now, but they should be a huge ally for us in this work, assuming that they're pushing that because they're working with college students, they are kind of modifying their message a bit to say, we're not going to start off saying you're terrible, so you have to stop altogether, because that's not what the people will stop listening. But anyway, it's going to be a good resource. Sorry, now you can close.
Thank you. Well, thanks again, everyone, for your time today and for sharing this information with others. We'll have the video recording up in the next couple days on the MATFORCE website that you can get others to go to that resource. We'll make sure if you don't have the email that went out, we'll get that sent again. Thank you for filling out the evaluation for Dr. Johnson. And thanks again, Dr. Johnson, for your work and for sharing with us today. Very appreciative.
Thanks to all of you. Thanks to all of you.
Thank you. Everyone have a wonderful day. So we will make sure I won't close out, make sure that we go through the chat. I know several people that didn't get, and if you want a copy of it, you're welcome. It was mainly